Hi, my name is Dr. Brian Batch, and I'm an adult endocrinologist at Duke University. Thank you so much for being here with me today. I'm here to talk about the preventable trial, and the question that we're trying to answer is, can a commonly used heart medication prevent dementia? My objectives today are to give you a background on dementia and an overview of the preventable study design. We're also going to talk about some commonly asked questions and answers to those questions at the end. So let's get started with a little bit of background. The goals of prevention overall to improve healthy life years. And what we know is that for individuals in the US who live to the age of 75, the likelihood is that they'll live to 88 years. Um, at the same time, those who live to 90 are likely to live to 95. And what we're trying to achieve are healthy life years during those years that individuals are alive. US adults that are older, 75 years, are living longer, as we talked about, and about 42% of those individuals are healthy. But 58% of individuals that are greater than or equal to 75 years have dementia and or disability. And so again, what we're trying to figure out is how to prolong healthy life for individuals who do not have dementia at the time um, of the age of 75. You might ask the question, what is dementia? Well, dementia are changes in the brain that make it hard to think clearly. Dementia can affect one's ability to do everyday activities, may include memory loss, and dementia is really an umbrella term for many different types of memory loss or thinking abilities that are severe enough to interfere with daily life. So you might have heard of things of Alzheimer's disease, Parkinson's, vascular dementia. Those are all different types of dementia. Importantly, Alzheimer's disease in the Latino community is common. The Latino community is estimated to be 1.5 times more prone to develop Alzheimer's disease than white non-Hispanics. And so this is a really important topic that we feel passionate about in the trial. So the question is, can heart medications prevent dementia? Well, we know that blood pressure medications have been shown to prevent dementia, especially when targeting treatment to lower systolic blood pressure. That's the top blood pressure number to less than 130. And some studies suggest cholesterol-lowering medications can reduce the risk of dementia and disability, but we really don't know for sure. And because of this, there is growing interest in the role of statin medications, of cholesterol medications in the prevention of dementia. So let's talk a little bit about the preventable study design. Well, who's eligible for preventable? You're eligible if you've never had a heart attack or stroke, if you're age 75 or above, if you've not taken a statin in the past year, if you have a person you trust that can inform us of your health and well-being. We call these people trusted contacts. And if it doesn't matter, and it doesn't really matter what your cholesterol level is. The study design here is pretty simple. If you look on the right side of the slide, age individuals who are 75 years or older who do not have cardiovascular disease, dementia, or disability will be randomized or placed into two different groups. One group will take active drug called atorvastatin, and another group will take placebo. Placebo means a pill that's not active, does not have active study drug. And then we'll follow those individuals in both groups and look for whether they develop Alzheimer's disease or disability. Participants, if you look on the left side of the slide, participants will be followed through yearly phone calls and cognitive and physical function testing, so you don't need to come to the study site. And you'll also be followed through your health records and Medicare claims. We have over 100 study sites across the US, both non-VA and VA sites, VA for Veterans Affairs sites. And then if you notice on the bottom left of the slide, we have our preventable telesite, which is capable of enrolling English and Spanish-speaking participants nationwide. We're really thrilled that we have participant advisors that we call the preventers. They are individuals 75 or greater, and they are just been excellent partners in helping us to understand what might work best for the trial and for the participants. We ask these individuals to help us with things like how we communicate and what mode of communication with participants, the best way to think about how to design the trial at the very beginning, and also how to continue with the study. So we're grateful to them. Now, you might wonder, why should I participate? And we thought it would be really helpful to share the why of participants that are already in the trial. Thomas from Tennessee believes that diseases like dementia can be difficult for families and steal time and joy away. So he believes research in older adults is especially important. Jacqueline from Georgia said that she participates in Preventable because it helps her to maintain the importance of my own mental health and cognitive health. She states this helps me recognize those issues in others, for example, in my Silver Sneakers water aerobics class in my church community. Marilyn from Connecticut thinks participating in Preventable is easy, not a big commitment for her. She's also seen dementia firsthand in her mother and older brother, and by participating in Preventable, she hopes to honor her family, improve the lives of future generations, and monitor her own memory and brain health. So, the take home messages here are really that our nation needs to find ways to prevent dementia, and Preventable will test the benefit of statins, which has been promising in preventing dementia. And we need you and your friends to join. If your family has questions, we're happy to talk with them, and we really want to thank you for considering being a part of the Preventable trial. So, here's a few questions that we get answered often, and we thought it'd be useful to present these and then an answer to those questions. If someone decides to join the study but later changes their mind, are they able to withdraw easily without any issues? And the answer to this is absolutely. At any time, if a participant decides that they want to change their mind, that they're not able to do the study anymore, all they have to do is communicate with their study team or with the telesite, and they are easily able to stop being a part of the study. We'll also talk with people about whether they want to modify their participation. So they may not want to take the study drug, but they might be okay with phone calls. And so we can have those kind of conversations. Are there any risks or side effects participants should be aware of when taking statins as part of the study? So we really try at the beginning when we go through the consent form to go through all of the risks and benefits of the study. Statins can have side effects. They're not common, but they can happen. Things like muscle aches and joint aches. And so we talk with people about those potential side effects, what we do during the study to try to monitor those, and also how we can change study participation if side effects take place. Do participants need to have Medicare to take part in the study? The answer to this question is no. All of the study drug, all of the participation, anything that's necessary to participate is covered by the study free of charge. How will the results of the preventable study be shared with participants in the community after it ends? Once the study's done, and once all the data is looked at, and we have answers to the trial, we will communicate these directly with each of the participants and their family members, likely in the form of a letter. We may also have larger town halls where we talk about the study and the results. We'll also publish the results in scientific journals that are important, such as geriatrics journals, maybe cardiovascular journals, but we'll definitely be sharing the results with the wider scientific community and the preventable community. Are there any medications that would prevent someone from being able to participate in the study? The answer to this is likely no, but we will go over each individual's medication list to make sure that there are no side effects or interactions with their current drugs before they can enroll in the study. So with that, I want to say thank you. If you would like more information, you can call 833-385-3899 or visit preventablecommunity.org on the web. You can also take a picture of this slide and go to, which will take you to a website and more information about the study trial. And with that, I'll say goodbye. Thanks so much.